let's go from the lecture first, and then we will have a live demonstration. So, no, I think we don't need microphone. Okay, I'm a dermatologist.
Yeah.
And I'm the inventor of Agnes. So I'd like to explain what is the different point of Agnes with the other RF devices. The first, Agnes is a kind of radio frequency device. So you know, radio frequency is different from other energy devices such as laser or ultrasonic. So it makes heat. But since we know about if you understand about the physics and physical characteristics of radio frequency, we can use it better, so more wisely. Okay. So this is the you will do the translation.
Let me discuss.
Okay.
Có cần dịch không? Hay là cho nó?
Thầy cứ dịch đi ạ. Xong mọi người cùng.
Ok. Thì sao ta? Thôi giờ cứ livestream một mình bạn Anh ra đi, rồi còn ví dụ có gì không hiểu thì tôi chỉ nha, chứ giờ dịch nó kéo dài thời gian. Hoặc tôi sẽ dịch cái phần demo cho. I will be translating in the demonstration. They can understand with the slides on the
Okay. Okay, very good. Okay. This is the basic physics of every energy-based device, including laser and radio frequency. Fluence correlate with the watt. It's a kind of power generated from the device, and time. And reverse correlate with the surface area. So the fluence is a kind of energy density, or irradiance we call it, the other word. And so this is the same with in every energy-based device. But in case of radio frequency, there is a special thing we should understand is the electrical conductivity. Because we use electrical currents. So, but in our body, there are many things. So blood, or bone, dermis, collagen, or it's a kind of protein, and fat. They have different electrical conductivities. So once we can understand this difference, we can use more wisely. And one more thing is depth and size of the target. This is very important thing. And this is why I made the micro-insulated needle RF. So before Agnes, every RF device, they didn't control the depth or level of the treatment, but the skin thickness is very thin, less than 3 millimeters. So within 3 millimeters, there are many things. So epidermis. In the dermis, there is a hair follicle. In the hair follicle, there is a sebaceous gland or muscles, articular muscles, or blood vessels, and many things. So we should know the exact precise depth and size of the target. So that's why when we use radio frequency, we should know very in detail of the target size and depth. And this is the Agnes. This is the another radio frequency device. But in their maximum power, they give only 1 watt, very low, low power. and they have sine wave pattern. It's a normal radio frequency waveform, but in Agnes, we can raise up to 46 watt, and it has square wave pattern. So it's the same in laser treatment. This kind of flat top pattern waveform can minimize the surrounding thermal tissue damage. So that's why we made this kind of shape of the waveform. And this is the different electrical conductivity of our body. So in 1 megahertz radio frequency, in 1 megahertz, because Agnes is 1 megahertz, the blood has highest electrical conductivity, 0.7. Bone is very low, has very low electrical current. It is very difficult to make electrical current in the bone. And fat is very low, almost same with the bone. So this means to coagulate the blood vessel is very easy with low power. But to coagulate fat tissue is very hard, very difficult with low power. So it means we need high power to coagulate the fat tissue. So in wet skin, it's a dermis, collagen. There is our collagen, dermis. So it shows 0.25. It's much higher than the fat tissue. This is the big difference that we should keep in mind. It makes the different result at the same power. Okay. Here is the hair follicle. So you know the sebaceous gland is the appendage of this hair follicle. So this is the hair follicle of our cheek. So if we treat the acne with Agnes, our target is the sebaceous gland, should be. And the distance from the skin surface to the hair follicle, to the sebaceous gland, is only 400 micromillimeter. Very short. So if you want to destroy the sebaceous gland without skin surface burn, you should protect this narrow area. But it means we need some insulation length, very short insulation length to protect only 400 micromillimeter. But there was no needle arc devices which had short insulated part. I will show you later. And anyway, the size of the sebaceous gland, the length, is about 500 to 600 micrometers. This is a normal sebaceous gland. But in case of acne, there is a sebaceous hyperplasia. So the size becomes larger than 1 millimeter. So to destroy the sebaceous gland of the acne, we should make non-insulated part of needle at least 1 millimeter. And then the sebaceous gland is an oil. It's a kind of fat.
Yeah.
So it has very low electrical conductivity.
Yeah.
So we should increase the power or increase the time.
Yeah.
Okay?
Yeah.
So this is the Agnes. You can see the fat coagulation because Agnes can give very high power. This is the eye bag fat, follicle fat. But the the other RF
Thiết
device,
bị khác thì các bạn thấy không có.
they have very low electrical power that they cannot melt down the fan. Okay? This is the needle of Agnes. You can see T shape of the needle. So this T shape, the reason why I designed as a T shape is I want to stop to the target depth. So anybody insert this needle to the stopper, shoulder, here, can reach to the same depth. So for example, Elma, you know Elma? It's a made in USA. It's a very famous radio frequency device. It has insulated needle as well, but it has no stopper function. Okay, so it is very difficult to control the micromillimeter by our hand. So that's why I made the T-shape design to stop at the same depth. It makes constant result. And you can see a little bit transparent gelatin-like material. This is the insulation coating. So this insulation protects the heat to the tissue. So this length of insulation is very important. So for example, in case of acne treatment, we should make 400 micromillimeter of insulation to protect the skin surface to the sebaceous gland. This is the shortest insulation in the world. There was nothing like this micro insulation in other RF devices. And you can see the long non-insulated part. The non-insulated part is about 1 millimeter in eye needle for acne treatment. So this is the summary comparison between the multiple needling RF device and Agnes. As you can see, they have many needles. Sometimes the many needle has advantage, but in case of acne treatment, it is not. So because our target is very small, and we don't need to destroy other skin areas. So anyway, they have many needles. It means the power. So I told you the fluence relates with the power and time, and reverse relates with the surface area. So the power generated from the device divides into many needles. So each one single needle delivers very low power. Okay? But Agnes has only one single pin. So every power generated from the body device can be concentrated on the single needle. So we can give very high power to the target. So, and they have long insulated part. Normally the fractional RF needling devices, the length is 3 millimeters. About 90% of the needle is covered by insulation. So their insulation length is very long, 2.7 millimeters. So it is almost impossible to protect the narrow area from the skin surface to the sebaceous gland. But Agnes has short insulated part and long non-insulated part. They have very short insulated. So each single needle has low power and short non-insulated part. It is not possible. It is impossible to destroy the sebaceous gland selectively.
This way I explain to you. Cái này là ông bác sĩ Anh so sánh giữa thiết bị RF nhiều kim với thiết bị một kim. Thì cái nitro RF mà nhiều điểm á, thì nó sẽ có cái ưu điểm là nó dùng để trẻ hóa là chủ yếu. và phần lớn cái năng lượng của nó sẽ phân ra cho nhiều cái kim, cho nên là sẽ không có phá hủy được cái gì hết, mà chủ yếu là nó kích thích để tăng sinh collagen, nó trẻ hóa thôi. Còn nếu mà nói để điều trị mụn á, thì năng lượng của Agnes nó sẽ tập trung vào một kim thôi, cho nên cái năng lượng sẽ lớn đủ để phá hủy cái mục tiêu là cái tuyến bã. Cái thứ hai á, là về cái cấu trúc á, thì những cái kim mà nhiệt điểm như thế này á, thì nó có cái phần bao cách nhiệt nó quá dài, trong khi cái phần tỏa nhiệt của nó thì lại ngắn. Còn cái kim của Agnes á, thì nó sẽ ngược lại, cũng như là phần bao cách nhiệt nó ngắn để nó bảo vệ nó thường bì thôi, nhưng mà cái phần tỏa nhiệt nó đủ dài để cái năng lượng phát ra có thể đủ lớn để mà tiêu hủy cái tuyến bã nhờn vì hiện tại kích thước nó rất là lớn nha. Và như mình nói là do cái thằng kia nó có nhiều kim, cho nên năng lượng bị phân bố cho mỗi đầu kim, thì cái năng lượng mỗi đầu kim nó sẽ thấp hơn rất nhiều, nó không có khả năng tiêu hủy tuyến nhờn. Còn năng lượng của Agnes thì nó chỉ tập trung cho một kim, cho nên nó đủ lớn để phân hủy tuyến nhờn. Thì hai thằng này nó được dùng ở mục đích khác nhau, có nghĩa là đối với multi-nido RF là cái nhiều kim thì được dùng để trẻ hóa tăng sinh collagen là chủ yếu, còn cái thằng nido RF của Agnes là chủ yếu dùng để hủy cái tuyến nhờn để điều trị mụn. Thì nếu mà dùng thằng kia để điều trị mụn nó sẽ không hiệu quả bằng.
Thank you. And this is a needle, microinsulated needles of Agnes. This I and C needle is for the egg. And S needle, S means shringoma. So for needle for shringoma. B needle is for the blackhead of the nose. And F means fat. So F1, 1 means single pin. F1 needle for the eyeball. And we have W needle. So W means wrinkle. There are two types, A and B. So A is 800 micrometer, less than 1 millimeter in length. So for wrinkle of the eyelid skin, very thin skin. And B needle, W3B needle is 1.5 millimeter, so wrinkle for other areas of the face or neck. So each indication has different needles because the target depth, size of target, the level of the target is different. So that's why we should use different kind of needles. These are the indications of Agnes. We can treat acne semi-permanently to destroy the sebaceous gland. And by same mechanism, we can treat the blackhead of the nose. And we can treat the shringoma and other benign skin tumors. And we can treat the wrinkle, especially difficult areas, periorbital or perioral or other areas of our faces. And we can treat the eye bag, non-surgical. And we can treat the scar, especially very severe fibrotic type banded scar. And we can treat the double chin, so open-ended flat question and others. I will show you later. And but the most important concern is the safety. Okay, because as you can see, the normal microinsulated Agnes needle doesn't make burn on the upper part of the needle. So as you can see, like this is non-coagulation, coagulation.
Yeah.
But if there is no insulation, you can see extensive skin surface burn. So to check the insulation status is very important. So I put the magnifying camera inside the device. We can check the insulation status before treatment. So without insulation, may burn like this.
Yeah.
Okay. So there is one single important thing to avoid make burn is press the foot switch after complete insulation. So don't press the foot switch during the insulation. So it makes burn. Okay, I'll talk from the acne first. The main concept of the acne treatment is to destroy the sebaceous gland without skin surface burn. So this is very simple idea. So like Columbus said, so there is no hair loss, no more hair. It's a permanent hair removal. No sebaceous gland, no more acne. But there are a lot of treatment modalities for the acne because the acne is the most common disease, skin disease. But these kind of treatments cannot prevent the recurrence because sebaceous gland remains after treatment. So the only way to prevent the recurrence is to destroy the sebaceous gland because no sebaceous gland, no more acne. But to destroy the sebaceous without skin surface burn, epidermal burn, has been very difficult because of this narrow area. We should protect this narrow area by micro-insulation. Like this. This insulation protect this narrow area, and non-insulated part destroy the sebaceous gland. And we did many studies and we published some articles. This is the first published article for the selective sebaceous gland destruction. So this is A is infundibulum, B is upper sebaceous gland, C is the lower bottom of the sebaceous gland. You can see the extensive destruction. This is histologic findings of 50 minutes after the procedure. And then 1 month after, you can see the treated area, there is no sebaceous gland. But there is a very simple, important question. Should we destroy every sebaceous gland for the acne treatment? The answer is no, because sebaceous gland has very important to protect the skin physiologically. So our target is only acne-prone follicle, not on every sebaceous gland of our face. So this acne-prone, because this acne-prone follicle makes relapse. So we can understand the pathologic changes of the acne. This is the early stage of the acne. There is a sebaceous hyperplasia, makes many sebums, and the many amount of sebum makes obstruction, and P. acne bacteria proliferate, and this is the inflammatory cell infiltration, attacks this wall of the infundibulum, follicular wall, and sometimes, in case of very severe inflammation, the wall of infundibulum, follicular wall, can be ruptured. So this rupture makes scar on the sebum pathway. So scar makes narrow point. So that's why by normal androgenic stimulation, the low level of androgen stimulation can make inflammation at some follicle, because this narrow area on the sebum pathway block the sebum secretion, makes anaerobic condition. This anaerobic condition makes a very good environment for the P. acne bacteria. So, and experimentally, we made acne on the rabbit ear by injecting P. acne bacteria in oleic acid, and then 4 weeks later, we confirmed comedone and by biopsy, and we treated with Agnes, and we compared with non-treated group, and this is 6 weeks later. In treated group, there is no sebaceous gland, no comedone, but non-treated group still shows comedone. And we started with 12 very severe acne patients. This is a prospective trial study. So I will show you on the result. So we treated 3 times. 1 time, 2 times, 3 times. We counted number of lesions. So before, after 1 time, after 2 times, the 1 month after 3rd time, is 1 year after 3rd time. You can see after 3rd session, about 90% of the inflammatory acne is reduced. This is a very remarkable result. So, and this is the protocol for the selected sebaceous gland destruction by Agnes. This is the normal, usual acne pimple. There is a sebum. This is the sebum. And this is the sebaceous gland. So our target is not a sebum. Our target is the sebaceous gland. So too much amount of the sebum disturb the delivery of the RF energy to the sebaceous gland. So step one should be extract out the sebum first by acne extractor. And then we destroy the sebaceous gland by Agnes. And there is one more step. The next day, or within 3 days, after destruction of the sebaceous gland, we should remove the debris once again, because once the sebaceous gland is destroyed, the debris comes out from next day.
Yeah.
It looks like some oozing or crust, but it can be an infection source again. So we should eliminate once again. The step one is the acne extraction. So more exactly, it's not acne extraction, it's the sebum extraction. So by acne extraction. So this is the our aesthetics in my clinic. Our esthetician should wear the magnifying loupe to see the hair follicle very closely, and we use the needle before needle puncture before acne extraction. Okay. So, do you think which one is the proper for the puncturing? From 30, 23, 21 gauge. What do you think? Maybe 30 gauge is less painful, but it is not enough to make wide action. So I strongly recommend 23 or 21 gauge needle. So it makes enough action. And the reason of why wearing the magnifying loupe is to see the hair direction. So because every hair has different direction, so we should make a hole with hair follicle inside. So only 0.4 millimeter is enough. But without, if you don't insert, make puncture with hair direction like this, makes only bleeding and pain. Okay? Yeah. And then applying the numbing cream for 30 to 40 minutes, and then do the Agnes to destroy the sebaceous gland. This is very simple method. Insert this needle into the pore. We can see the pore because this is after the acne extraction. We can see the pore, and insert and press 2 times. Destroy the center of the sebaceous gland. And then we give additional 4 single shots, north, east, west, south. And this distance from the center is about 1 millimeter.
1 millimeter.
Yes. To destroy the lateral lobule of this sebaceous gland. And in some cases, the large acne pimple, like cystic type acne or severe acne, we can see, if you see very carefully, we can see multiple pores. So at this time, we just treat the pore by pore, the same protocol. The first shot should be inserted into the center and give 2 shots. 1, 2. And then 1 millimeter apart from the center, or 1 single shot. 4 single shots. 1, 2, 3, 4. That's it. That's it. We destroy the sebaceous gland of this hair follicle. So, but you should insert to the stopper. To the stopper. Okay. and then press the pen. And insert needle with 90 degrees to the skin surface.
Yeah.
And next day, or within 3 days, patient should come again to remove the debris. So at that time, we use this bipolar handpiece. So this bipolar handpiece is very good for the wound healing because to destroy the sebaceous gland is a kind of making wound.
Yeah.
So from that point, wound healing process begins. So the critical period of wound healing is within 3 days. So within 3 days, if we give the heat into the skin, especially sebaceous gland level, we can promote wound healing very, very effectively. So that's why we apply the bipolar after the treatment. So at the time, we use ultrasonic gel. This is very usually we using this gel in US ultrasonic. So this is my combination treatment program in my clinic. So at the first day, patient come, I put the 50% of glycolic acid first, and then acne extraction. This is the step 1, and then using Agnes to destroy the sebaceous gland, and I give oral medication for 1 week. Yes, just for 1 week. We don't need to give long term. So usually minocycline or tetracycline or doxycycline. The reason I prescribe the oral medication is to subside the inflammation. Because to destroy the sebaceous gland doesn't reduce the inflammation. It's a separate one. Destroy the sebaceous gland and the reduced inflammation is totally separate one. So that's why we give oral medication. This is for the inflammation, not for the sebaceous gland. Yeah. And then next day or within 3 days, using bipolar handpiece, little bit melting, and then extraction once again. And if there is an elevated inflammatory pimple, inject intraregional steroid into the pimple, diluted one. So this is for the inflammation as well. And 1 week after, I request a revisit to the patient and applying the 50% of glycolic acid again and extraction once again. This is my protocol in my clinic. So, one session includes 1 time of Agnes treatment with 2 times of, we call 50% glycolic healing with skin scaling. So 2 times of skin scaling. So I will show you the long-term follow-up cases, more than 1 year and 2 years to show the fundamental solution of this recurrent acne, relapsing acne. She has acne on her cheek. She was 22 years old. This is 1 month after. I'm sorry. This is 1 month after. At that time, we just took photo. We didn't treat her. Took photo only. 3 months after, 6 months after, 1 year after. So we treated a little inflammatory pimples on here, and this is 6 months after the second treatment. So as you can see, she got only 2 times of treatment for 1.5 years. And she has acne on cheek. This is 8 months after. The treated area shows almost no inflammation, but she has new acne. So I treated second session, and This is 6 months after the second treatment. So as you can see, we don't need to treat the patient very frequently. The minimum interval is 1 month. Yes. She has very typical perioral recurrent relapsing acne. This is most common female adult type acne, especially premenstrual period. So this is 2 months afterwards, after the first treatment, and 1 more treated. This 6 months after second treatment, 15 months. And 2 years after second treatment, she showed new lesion. So I treated third treatment at this time. So she got only 3 sessions for 2 years and 2 months. And mandibular line. This is very difficult area, very easy to recur and easy to make scar. And anyway, we treated, as this is 1 month after, 1 more treated, 4 months after, 8 months after, clean. And 1 year after, she showed new lesion on the neck. I treated once again. This is 9 months after third treatment. So as you can see, there is no scar, okay? Because of step 3. Because we use bipolar handpiece after treatment, we promoted wound healing. It is very important.
Yeah, okay.
And she has very severe type of acne because she had polycystic ovarian disease. So I treated her many times. So 2 months after first treatment, 1 more treated, 5 months after second treatment, 1 more treated. This is 4 months after third treatment, 1 more treated. And anyway, even if she has very severe type of acne, eventually we cure. Recently, I treated the patient with Crohn's disease of the bowel. So she takes immunosuppressant drugs for a long time. So she had very severe acne. But I treated her 4 times. Now she's almost okay. So, I mean, even if the patient has internal problems such as polycystic ovarian disease or the patient who intakes the medication, we can treat any kind of acne patient. This is difficult area as well, but this is 2 months after surgery. So the reason we can get the long-term cure is we destroy the sebaceous gland. The sebaceous gland is a factory of the sebum. So no sebaceous gland, no more acne. So, but we don't need to destroy every sebaceous gland. Just acne-prone follicle is the problem.
Yeah, okay.
And next issue is the wrinkle, especially eyelid area. So we inject the Botox, the lateral part of the wrinkle of the periorbital area, not on the upper eyelid, but not on the lower eyelid wrinkle. So because the reason to treat the lower eyelid wrinkle or upper eyelid wrinkle has been very difficult is the skin thickness of eyelid is very, very thin, too thin. It's less than 1 millimeter. So this is the published article. As you can see, the eyelid skin has less than 1 millimeter in thickness, and so that's why the HIFU or Damage couldn't treat the eyelid wrinkle because the minimum focusing depth of the HIFU is 1.5 millimeter. But eyelid skin is less than 1 millimeter. So they bypass the skin. They give the heat under the skin. The Damage has contact cooling system. The contact cooling makes skin cool more than 1 millimeter in depth. So the energy of the thermal delivered under the skin. So I made a very short needle. This is 800 micromillimeter W3A needle, and upper 50% is covered by insulation, so that we can give the heat within the eyelid skin. Okay, this is a ultrasonic view of my lower eyelid area. So from the outside, this is the epidermis. The thickness is 0.1 millimeter, and here is the skin. From here to here is skin. My skin thickness of eyelid is 1 millimeter. So this W3A needle protect the upper part and give the heat into the dermis of the eyelid. Under the skin, there is a muscle. This is a, orbicularis oculi muscle, very thin muscle. And under the muscle, there is a orbital septum. And under the septum, there is an infraorbital fat pocket. So I measured the distance from here to here. The skin thickness is 1 millimeter. The distance from the skin surface to the septum, 3 millimeter. So this is another published article. So we treated the eyelid skin wrinkle, and using W3B needle, longer needle, we treated upper lid wrinkle. And this is our lab. To treat the eyelid wrinkle is very simple and very easy, but one important tip during the treatment of the periorbital area is to stretch the skin tighter, very tight. Yes. Because the hair is very soft and redundant. Without skin stretching, it is not possible to insert the insulated part of the needle. It is very difficult, almost impossible. So, but if we stretch and then insert, it is very easy to insert needle, because the needle is only 0.8 millimeter. So, and we performed clinical study with 20 eyelid wrinkle patients, and we took before and after one session photos. This is after 2 sessions. You can see the wrinkle line is declining before and after. Before and after. We can treat the eyelid wrinkle with topical lidocaine cream only, because the needle is very tiny, only 0.8 millimeter. So we don't need to inject the lidocaine, but we need enough time to be anesthetized by cream. This is another. So we can compare the treated part and non-treated part. So she has upper eyelid wrinkle. We can see the upper eyelid wrinkle and a little drooping before and after. Before and after. Before and after. You can see the drooping wrinkles as well. Other patient. Before and after. This is the Caucasian Australian case. Before and after. This is the German case. Before and after. This is setting. And wrinkles of other area, upper lid. So we use W3B needle, longer needle. A needle is 0.8 millimeter. This is 1.5 millimeter. So actually she's my mom, the friend of my mom. And she's the mother of Dr. Holman. He's a key doctor in Australia. He treated his mom. So you can see her chin and her body shows great improvement. So she's a German case. You can see her wrinkle lines on the cheek is very much improved. She's a same German case. She has a jawline as well here. So he treated wrinkles on here with W3B needle and fat collection made down by F needle. And this is before and after. Before and after. Before and after. So you can see the result. So during the eyelid wrinkle treatment, I found out the eye bag is also improved as well. By tightening of the skin, we can push back the herniated fat into the orbit side. Because the eye bag is a kind of fat herniation. So due to the loosening of the skin. So once we tighten the skin, we can tighten here, we can push back the herniated fat into the orbit side. So, and then I thought if we insert needle into the fat pocket directly and make down the fat, we can reduce the volume, make tighten and reduce volume, makes more improvement. So this is the F needle. So needle length is 5 millimeters, very long. And upper 50% is covered by insulation and lower part non-insulation. So the reason I made 5 millimeters is the distance from the skin surface to the orbital septum is 2 to 3 millimeters. So this 5 millimeter needle can penetrate into the fat pocket and melt down the fat. So I put out the fat pocket surgically, and then I tested before I tested the fat melting to decide the power and time. So actually, I found out that we need very high power and time to melt down the fat. So this is before and after size. So, but to insert long needle into the eye bag is a little bit dangerous. So I made a method, safe method, protect the eyeball. If we press the eyeball, we can merge out the fat. And then nurse pull down, a little bit pull down this orbital malar ligament downward. This merged fat moves down. So, and then we can insert needle with safety. And we started with 24 patients, the eye bag patient, with Seoul National University team. This is the marking. So we should inject into the fat pocket deep inside because fat located in the deep area. And we gave the score from 0, 1, 2, 3. So none, mild, moderate, severe. And we measured with 3D photographic assessment. We got the patient satisfaction score, and this is the result. The baseline, the before treatment, the score was, average score was 2.2. It means moderate. Average was the moderate. This is the result. After 2 treatments, so the volume is reduced about 63%. Not 100%. There is no 100%. So because this is not a surgical removal. So we reduce the volume. And that's the key point when we explain to the patient. So we can reduce your eye bag. We can reduce your eye bag. And we can tighten your wrinkle at the same time without surgery. This is the non-surgical. If you want surgery, go to the plastic surgeon. But if you don't want surgery, I can help you to reduce your volume and to make it tighter. And this is the patient satisfaction score. They feel about 70% of volume reduction after 2 times of treatment. This is photos before, after 1 session, after 2 sessions. Very naturally looking. So not like surgery. If you make excision and put out and suture, so we frequently make unnatural looking like this. But this is very natural. Before, after 1 session, after 2 sessions. So somewhat the eye bag is remain, but we reduce the volume very dramatically, and we made tightening of the wrinkle. Before, after 1 session, after 2 sessions. Sometimes there is a patient shows poor result. So if you see this patient very carefully, she has a tear tooth on here because she has short ligament on here. So this kind of patient needs additional filler injection on here. Okay? So we can combine with surgery or with filler or the other procedures. So this is a lateral. You can see the bulging on here is flattened after treatment. So she's my mother, and she was the first patient 3 years ago. I treated her skin tightening only at this first time. But her wrinkle is improved, and then the volume is reduced by tightening. And then one more treated, and this is 2 years after 2 sessions. So I can say the effect can go more than 2 years. More than 2 years. She's a friend of my mom. The before, after 1 session. He is very interesting. He's Dr. Zimmermann in Frankfurt in Germany himself. So he treated by his colleague. Before, this is after. He's the father of our woman doctor in my clinic. So we always do with our family. So before, this is immediate after. And 8 days after. Sometimes patient shows very quick, rapid result. But this is before, this is 3 weeks after. Because this is not enough to make skin tightening. She shows some wrinkles on here, but by time goes, we can see better results. So you can see the bulging on here, the flattening here. He's a professor in Shanghai. He's a dermatologist, but he has unilaterally big eye bag on the left side only. So I treated left side only. Immediately after 7 days, 10 days. This case is from plastic surgeon, Dr. Pa. He combined with surgery and Agnes. He put out the eye bag by transconjunctival removal and tightened the skin to prevent the wrinkle aggravation after volume removal. Because usually, by transconjunctival fat removal only makes wrinkle aggravation because of deflation effect. So this patient has very big eye band. So the patient like him, usually transconjunctival fat removal only makes skin sagging after treatment. But by combining with Agnes skin tightening, he shows no sagging, no wrinkle. This is what and we can treat the double chin as well using 3-pin F needle. He's a Professor Kim. He's a dermatologist in German University, Korea. He's very famous people. Before and after. So we can see before. This is after 1 month, after one session. So I treated twice, 2 times. The before, this is 2 months after 2 sessions. She's an Australian case. It's a before and after. She's a German case. Before, after first treatment, after second treatment. Before and after. And she's a different case. She injected autologous fat to here, but she complained. She did another cleaning and came to me to solve this problem. So in lateral view, there is a bulging. This is unnatural looking. So we can make down this kind of fat by F needle. So this is 5 months after. So we can repair or correct. So double chin treatment by Agnes is very effective and minimally invasive. And next day they can take shower. And less swelling than, Kybella. So it's very injectable for fat melting is very expensive and painful and big swelling, but minimal downtime in case of Agnes treatment. So we can get the skin tightening as well. We can repeat the time. This is another Australian case. You can see her wrinkle eyelid, the double chin, jaw, okay. Let's go to the live demonstration and we can discuss Q&A.
Okay.
Is there any question?
Yeah, I have a question.
Yes.
I want to ask you about. You said that the minimum interval between each session to treat the acne is 1 month.
1 month.
And can you explain why?
Because in case of acne treatment, the 1 month interval is the Agnes treatment. So sometimes patient can show inflammation 2 weeks after or 3 weeks after, but we don't need to treat once again because we should wait for the wound healing at the treated area at least 1 month. So usually the inflammation from the treated follicle 2 weeks after, 3 weeks after, you don't have to worry about it because even if the sebaceous gland is disappeared or eliminated or destroyed, the inflammation can be remained for 1 week, for 2 weeks, for 3 weeks. But that's the inflammation. There is no sebaceous gland, so we don't need to treat again at the same follicle if there is inflammation. So, but 1 month after, it's a different story. So if the same follicle shows acne 1 month or 2 months after, it means incomplete destruction of the sebaceous. So at that time, we should treat once again. But usually, once we treated that follicle, does not recur. That follicle does not recur. The another untreated follicle shows recurrence. So usually, I follow up the patient 1 month after first treatment, even if she has acne or she doesn't have acne, to see the status. And then 라이브 준비해줘. 강의 다 끝났어. 그리고 and then if about 50% of patient shows no acne, that's 1 month after first treatment. So if the patient has many acne 1 month after the first treatment, we should treat second treatment at that time. But no acne after 1 month, I follow 1 or 2 months later. And then if there is no acne, I follow 1 more or 2 months more later.
Yeah.
Okay. Anyway, because we destroy the sebaceous gland, it's a fundamental way. So the recurrence rate of acne is very low. The average treatment time is usually 3 to 5 times. They're usually less than 5 times. Some patient does not visit or 1 or 2 sessions after for 1 year. It's good to happy to the patient, but some patient needs 5 times of treatment within 1 year. It depends on the patient condition. But anyway, we can say, because we give the fundamental solution to the patient, this is the final solution of the acne. So we can control the chronic relapsing acne, and we can have a very good result with this scar patient, because this is kind of radio frequency energy. It makes hair scar remodeled. Okay, I will show you the acne patient first.
Đấy thì bác ấy quay lại cái slide, mấy cái slide đầu tiên em quên cái câu hỏi.
Slide gì?
Mấy cái slide đầu tiên em không nhớ đâu.
Là slide số mấy sao tự nhiên phép lại là
I want to ask
Yes.
another question. You said that after the treatment, we maybe 1 or 3 days after that, we see the cyst. We can see the cyst, and it can show that the sebaceous gland destroyed.
You mean the cystic type acne?
Yeah, the cyst after the treatment,
Mm-hmm.
either symptom show that the sebaceous gland is destroyed.
Actually, in case of cystic type acne, it's difficult to treat at one time, because pathologically, the sebaceous gland is atrophy. Atrophy. In case of cystic diabetes. So it means it is difficult to localize the gland.